For individuals on blood thinners, especially vitamin K, sensitive anticoagulants like warfarin, managing diet can feel complicated and restrictive. Foods high in vitamin K often raise concern, as vitamin K plays a key role in blood clotting and can interfere with the intended effects of these medications. Blackberries, which contain moderate amounts of vitamin K, are frequently questioned in this context. The truth is, blackberries can be safely included in the diets of people on blood thinners, with some simple precautions and a focus on consistency. Blackberries provide around 28 to 30 micrograms of vitamin K per cup, which is not exceptionally high compared to leafy greens like kale or spinach, but still enough to be relevant in the context of anticoagulant therapy. The vitamin K they contain, specifically K1, helps the body produce clotting factors, which is precisely what blood thinners like warfarin are designed to counteract. Sudden increases or decreases in vitamin K intake can cause fluctuations in how effectively these medications work, either raising the risk of clotting or increasing the risk of bleeding. However, the solution is not to avoid vitamin K altogether. On the contrary, consistent daily intake of vitamin K from food sources is often recommended to help maintain stable INR, International Normalized Ratio, levels, the primary measure used to monitor blood thinning in warfarin users. It is inconsistency, not vitamin K itself, that poses the risk. Eating blackberries regularly as part of a balanced diet is unlikely to interfere with blood thinner effectiveness, as long as the amount consumed doesn't vary dramatically from day to day. Additionally, modern blood thinners like apixaban Eliquis, rivaroxaban Xarelto, and dabigatran Pradaxa are not influenced by vitamin K at all. These direct oral anticoagulants, DOACs, work through different mechanisms and allow much more flexibility in diet. For individuals on these newer medications, blackberries pose no concern whatsoever and can be freely enjoyed. Even for those on warfarin, the benefits of blackberries, antioxidants, fiber, vascular protective polyphenol, make them a worthwhile addition to the diet when eaten mindfully. Their anthocyanins may support healthy blood vessels and reduce inflammation, which could potentially complement overall cardiovascular health and lower long-term clotting risk. They also contain no saturated fat or cholesterol and have a low glycemic impact, important considerations for heart health, which is often the reason people are on anticoagulants to begin with. That said, any significant dietary changes, such as suddenly increasing your intake of vitamin K, rich foods like blackberries, or drastically cutting them out, should be communicated with your healthcare provider. Regular monitoring of INR levels allows adjustments in medication to match your eating habits, rather than forcing dietary restrictions that may lower overall nutrition quality. In summary, blackberries are safe for most people on blood thinners, including those on warfarin, when consumed in consistent amounts. Their vitamin K content is moderate, not extreme, and their other nutritional benefits support heart and vascular health. The key is not elimination but stability. With careful planning and open communication with your doctor, blackberries can remain a delicious and health-promoting part of your routine, even on anticoagulant therapy.